Hi, I'm Tracy and I'm a registered nurse. I'm currently working at Insight as a clinical nurse educator. Once the acute physical side of withdrawal has finished, some of the more medical support might drop off a bit. We'll get a lot more of the psychosocial type team in, allied health and peer group supports. There might be some medications that we can give to assist in that post-withdrawal phase, and that might include some anti-craving medication. But generally, we're going to move on to more supportive measures from other team members.
My name's James. I'm one of the educators here with Insight, and as a psychologist, I've worked for many years with people who've been looking to make changes with their substance use. If I was to say, what have I found useful in working with people who've completed a withdrawal management program and who are stepping back into their life and their ongoing journey of making change, I would have to say that one of the main ones has been encouraging people not to take too much on straight after completing a withdrawal management program. There can be that kind of drive sometimes to want to get back into getting a lot of things and maybe potentially restoring different relationships, different activities, and energy levels don't always stay at that high in those early weeks and months of recovery. Sometimes it can go from a bit of a honeymoon period to a period of where people find that there's a few bumps in the road with maybe potentially learning new ways to deal with stress, learning new ways to deal with emotions that aren't relying on maybe the substances as being the primary way of doing that.
Hi, I'm Dan Phillips. I'm a psychologist with the Withdrawal psychosocial treatment team. With our work, the things we look at with people are, what might be the benefits of their drug use and what were they gaining from it. Trying to work through all this, a plan can be really helpful. People can often feel a bit overwhelmed and expect to be able to make changes that day. If you've got a problem, then stop it. But it rarely falls into place that quickly. We try to prevent relapse, and so there's different triggers that could be involved that people are trying to deal with, like what do you do when you're feeling bored? What else can you do? Alternative activities are a big part of that, and so trying to plan things in. There's a big gap in people's life where the drug use was, and so trying to put other things in place. And another important thing to cover too is, what do you do if you do have a slip-up? For many people, a slip-up can be quite devastating, and they'll feel really down and can get really hard on themselves and think, this is never going to happen. I'm hopeless. I can't do this. And so it's good for people to hear that it's quite normal, that if you talk to people who have made changes, a tiny percentage just goes straight through and do it. Most people will have slip-ups along the way and have lapses and relapses. And so just normalizing that, that's part of the process. And then what are you going to do if you do have a slip?
Hi, my name is Matt. I'm one of the alcohol and drug lived experience educators with Insight. Encouraging people post-withdrawal to engage in peer-based programs or mutual support groups like 12-step programs or smart recovery can help them to achieve their individual goals and identify coping strategies to deal with cravings, develop refusal skills, and plan for future triggers and high-risk situations.